Hello, beloveds. Welcome to Love Revolution with Dr. Roz. I am delighted that I get to introduce y'all to Michelle Kelly. And so before I do that, though, I'm going to read the Be Loved Pledge. This is how we start every single episode of this video series. And as always, if you'll go to thekingcenter.org/be loved, and you can see the pledge there. If you are so inclined, you can sign it there. And so we're going to get started. It says, join us around the world in taking the pledge. I acknowledge three things. The violence, oppression, inequity, injustice, and hate in our world has to stop. I have a responsibility and role to play in creating social change for a more just, humane, equitable, and peaceful world. The decision is mine whether to do nothing in this moment or to have the courage to stand up for justice. And starting today, I make a personal choice to be loved. I pledge to allow love to drive my thoughts, words, decisions, and actions, and honor the humanity of every individual. I pledge to speak the truth to power and love. I pledge to focus on defeating injustice and not destroying the person. I pledge to support leaders who demonstrate a love for humanity. I pledge to promote unity and refuse to perpetuate or magnify division. I pledge to demonstrate a life of courage, care, and compassion as I boldly confront anything that stands in opposition to love. By signing this pledge, I'm helping to create what Dr. Martin Luther King Jr. called the beloved community. And with that, beloveds, I'm going to introduce you to Michelle. Michelle, tell us a little bit about you and your business, and really dig into ways that you're using Agape love in your own practice.
Wonderful. Thank you for having me, Dr. Roz. I feel honored to have this invitation. I am a pediatrician practicing here in Atlanta for 22 years. I trained at Emory. I am a pediatrician, and I have struggled through the years with the increased incidence of anxiety and depression in our young people. And I myself, when I started in my most recent practice as a pediatric physician since 2005, my beloved community, I was very regular since that time with yoga. And I knew yoga was a way that I could ground and collect my thoughts and not let anger get the best of me, because I have a fiery nature. For anyone who is a yogi, I have more that pitta fire. So I can get a little intense about when I have passions, especially for children. And so this anxiety and depression that was really was overwhelming pediatrics before the pandemic really made me think, you know what, I need to get my yoga teacher certification. So I did yoga teacher training in 2018. And that was transformational for me personally and professionally, made me enjoy my job more. A lot of people thought I was transitioning from pediatrics to becoming a yogi, and that was not at all the case. It was a supplement to who I was as a healer, a medical care provider. And so just about when I was going to start teaching classes in our office, well, we all know what happened. We got hit with the COVID pandemic. And I had been teaching in a private studio, which I had to stop once our lives became more, we have to be very careful. So I stopped teaching in the yoga studio. And I just continued my individual practice. And then we got through the pandemic for the large part and feel in a much more stable situation. But I would say that the pandemic was tremendously difficult on everyone, but healthcare providers took it in a very, we were at the front line of it. And I would say fall of 2021 was the fourth wave, and I took a hit emotionally that I had never
Wow.
experienced before.
Mm-hmm.
I'm around a lot of anxiety and depression. I did not want that to be me. That there's a family history for me. And I just had to say, okay, I surrender. I too am feeling the weight of all this. And I started right then and there to make the decision that I would add to my yoga meditative practice mindfulness.
Ah.
And I started a mindfulness teacher training program through Mindfulness Center of Atlanta and Mindfulness Northwest.
Wow.
So I started that exactly a year ago. It's a 2-year program. I am already teaching 8-week courses. It really was the pivot for me when I sunk so low with sadness and anxiety and depression last fall.
Mm-hmm.
I do want to give a shout out to Mark Danfeltzer, who is the head of Mindfulness Center of Atlanta, because I reached out to him and said, I got to find my pillars again to get me reestablished. So I reached out to my favorite yogi teacher, Sheila, and she owned Johns Creek Yoga. And I got these people that were meditative, reflective, and used their body as a way to center.
Yes.
Because our thoughts were all racing, all of us.
Mm-hmm.
You think it was just, the typical teenagers having racing thoughts. The doctors had racing thoughts. What's the next step? What's going to happen next? Yeah. And so I thought, as in medicine, the best way we learn is by teaching. And when we go through medical school and residency, we say, see one, do one, teach one, when we learn any procedure or skill. And that was, I thought, yes, I have to embrace this for mindfulness.
Wow.
And it was busy time in my life to do it. Mark was like, Michelle, really? You can fit this? And I said, I will. And so my wonderful practice, pediatric physicians, let me lighten my schedule. And I was able to really embrace this in the past year. And I'm going into my 2nd year. And I'm starting my next 8-week course a week from today.
Outstanding. Okay. Outstanding. I love a pom-pom, and I'm just going to give you a pom-pom, Michelle. I mean, what a rock star you are. What a rock star you are. Wow. 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 So much of what you said, I have 1,000 different questions. One of the things I want to say is, number one, thank you for being you. Thank you for the beauty that you bring to the world. And what it sounds like to me, and so if I am putting words in your mouth or if I'm incorrect, then please correct me. But what it sounds like is that you started a practice that was great for Michelle. That's but right. You realized that it had implications in all these other different facets. Absolutely. And one of the lines in the pledge is I promote unity and refuse to magnify division. And it sounds like you were seeing some division with people with the racing thoughts, and people were not coming together, and people weren't having a community, and they were feeling anxious and depressed. And you said, what is it that I can do? And we talk a lot about in terms of nonviolence, that it starts with me. Mm-hmm. So that, like, you truly, like, literally embodied that. Mm-hmm. So can you talk a little bit about how it started with you, and then what does that look like today? Like, where's the outreach? Yes. So I would say I noticed it first in my office when I came back from a yoga retreat. I've gone to some pretty nice places and it had some really nice experiences. And most recently I've done silent retreats, but in the past I did yoga retreats. And I came back, and my patients, again, since I've been there for 22 years practicing here in Atlanta, they're like family members. I'm seeing these kids, they're aging with my children. The parents are aging along with me. And so I came back from retreat and I realized I need to sit more with my patients. And so I asked
my practice manager, can I have stools? And I started sitting down with the family. And even now, whether it's a sick visit or it's a well visit, I sit and listen.
Mm.
And that is the biggest thing, the first time I saw the implications of myself sitting and practicing and listening. And a spiritual leader once told me that listening is joy in action.
Oh, I love that. Wow. Listening is joy in action. Wow. I love that.
And then my job that I thought was stressful, perhaps through the years, especially when my kids were younger, became like almost I looked forward to each interaction. Yeah. Where I used to be like, oh, that one's going to be difficult. That's going to be a substance abuser. Like when I see who's coming next, oh, that's going to be a depressed, suicidal teen. Now I'm like, how can I help?
Yeah. Yeah.
Because that's what I'm here for.
Yeah. Yeah.
It was hard when my children were younger. I absolutely have that issue all the time. I talk to people about being mindful and doing yoga and taking time for yourself. It's hard when you're ministering to little people day in and day out. But I've gotten to this point where my youngest is 14 and I'm really able, I don't have to rush to go and say, I have to get home at 6 o'clock. I can sit more and be with people more. So that's how things it changed for me in private practice.
So I'm curious, do you think it's the listening more, or is it the sitting, or is it the interconnection of the two? Is it like, what aspect of, I mean, could you get the same results if you weren't sitting? I guess that's what I'm asking.
Absolutely.
Okay.
But it's presence.
Okay.
It's looking my eyes to the child's eyes or the parent's eyes and connecting as if you were on a date per se, right? I'm seeing them sometimes for the first time, it felt like.
Yeah.
And by me sitting, because doctors and nurses are always moving, they're going in and out and in and out. By me sitting, it says, I'm going to stay a while and be with you.
Yeah. Yeah.
Yeah. So for me, that was a body cue for me. So if I'm at the computer, I'm typing and next screen. But if I sit, I'm like, okay, we're going to have a conversation.
Right. But as you're sitting, are you jotting down notes in their old school paper file? Are you?
We're an electronic medical record, as most practices are these days.
So if I'm taking notes now because that's how my brain works, and so I want to jot things down. So how do you? How do you capture the things
that we talk about? Oh, on a computer. So we're like,
okay, so you're sitting, but you're typing as you're sitting.
That's right. But often I don't type, but that's why I wanted the stools. Because then I'm level with my computer.
Okay.
The problem is, again, in pediatrics, stools have wheels that spin.
Okay.
And little people want to get on them, and then we have people falling. So it's always been a thing. But we all know Dr. Michelle's stools have to be in her rooms. And at least one of the other doctors has embraced that. And maybe 2 or 3 more other doctors have embraced that.
Excellent. As I said, there's so many things that I want to ask you. The thing that really resonated with me was see one, do one, teach one.
Yes.
Can you talk a little bit more about that and about what you're most passionate about seeing and doing and teaching?
That's right. So in medical school, I think everyone has a general idea of how intense it is to come in and put an IV in someone. But we're learning on the job. I trained in the Bronx. I was at Einstein in New York.
Wow.
And so there was an upper level resident than a first year and then a medical student. And so skills were constantly being going down the ladder so that the resident would get the first try from the upper level resident. And then that resident would then teach the medical student. And then sometimes there wasn't enough, and maybe a nurse had to teach us.
Okay.
Literally a procedure, not now, I'm not doing it in private practice, but we would put a spinal needle into an infant's back.
Wow.
Do a lumbar puncture.
Wow.
And that became so second nature to us. But in the beginning, you are literally doing, you're seeing, we say see one, but you see a couple.
Yeah.
You do it. And then that quickly, especially in a busy city hospital, here it would be Grady. I would Jacobi and Montefiore and Einstein. And it's a skill that you're taking and you're using, and it becomes second nature.
Wow.
And much of medicine works that way.
Yeah.
There's been hour modifications with residents, that have made things a bit less traumatic on a physician. There's more checks and balances, I guess I would say, in place. But I wouldn't have had it any other way. That's how I learned to be the doctor I am.
Right. So it's kind of the opposite of that old telephone game. Because the telephone game, I tell you something, and by the time you tell that next person and they tell that person, then it's gotten warped. But in yours, it's the exact opposite. It's that I have some expertise and I'm teaching, and they are in turn, they're watching me, but then they're doing it and then they're teaching. And so it's that reinforcement constantly of best practices.
That's exactly correct.
So, so do you do that with your pediatric patients and yoga or mindfulness? I mean, do you in the part as a part of your?
Yeah, not in an official way, not in terms of classes yet. In medicine, we really need things to be proven in randomized controlled studies for us to, let's say, for lack of a better word, legitimate, right? Have the credentials. We never want to do, at least do no harm.
Right.
And so I know what works in certain ways. So I will give little tidbits of skill.
Yes.
And I have laid down on the ground and shown primarily mothers poses that could be helpful for them to relax.
Wow.
Especially postpartum moms.
Yeah.
Just to have 2 or 3 poses before they go to bed at night that just calm the nervous system.
Right.
And for the kids, I work more with breathing and, becoming aware of thoughts.
Yeah.
I was going to say specifically, I think the example that I give as a pediatrician is when I see interactions between parent and child. And I used to just judge and perhaps make a statement. Now I just observe and try and cast it in a way, what I might make a recommendation, I would cast in a way of, well, this might work. It has worked for me and my children, and it helps that I have a 21, 19, 14-year-old.
Right.
Who have been my Zen masters.
Yes.
And so, for instance, I'll hear a lot of parents make a comment about their child, which stings me. And I know that this parent does not mean that sting. I know they do not.
Right.
And so I will just say, well, maybe we choose these words.
Right.
And then I can see the teenager's shoulders that are just like up here.
This.
Right. Yeah. And it can be dangerous for me. I can make parents not happy with me because I will. if I see something where a child's being burdened, I feel like maybe if I could just let them see that how painful that was for the child.
Right. Right.
But I have found myself in the middle of a child on a table, especially a teenage child, and a parent here screaming at that child. And this parent is screaming out of frustration.
Right.
We live where I live here in Alpharetta, Roswell, our 2 offices, for the large part affluent. Kids have their needs fulfilled in terms of food, shelter, clothing. But those other needs are really rising to the top.
Yeah.
But parents are so, well, they're struggling. They're trying to keep hold of a job, get food on the table, but those other needs of attachment and connection, being seen, well, they weren't thought to be important when I was being raised. So trying to put a spotlight on that.
Right.
By the way, that I'm an observer.
Right. Right. And with kindness and love.
Right.
You know, because if you are a part of a situation where a parent has made a comment that stings you, and therefore, has absolutely, pierced the soul of their child. But then if you in turn meet that sting with another sting,
that's right,
then that's just perpetuating that. So it's being a disruptor of that, to say, hey, here's a loving way that we can look at this situation. Yeah. Dr. Michelle, I could talk to you forever. This has been so delightful. I just want to say thank you for being a part of Love Revolution. Thank you so much for agreeing to this interview. My life is richer because I have been in your presence, and I am just so grateful. So thank you so very much.
It's been my pleasure, Dr. Roz.
See you soon, I hope.
Okay, bye-bye.
Bye, everybody.